Bismillahirrahmanirrahim. Today we are going to start with the case studies regarding the hypertension, and for that we will study it from the book Clinical Pharmacy and Therapeutics by Roger and Wackel and Cat Wixley. And the chapter is the hypertension, chapter number 19, the starting of the cardiovascular disorder. And from that I will highlight the main points which are the main focus for us. So hypertension is basically disease which is worldwide responsible for the morbidity and mortality. It is the disease responsible for the various cardiovascular complications. What are these? These are the stroke, myocardial infarction, heart failure, renal failure, and problem in the aorta. If we talk about the non-pharmacological treatments of the hypertension, it includes the weight reduction, avoidance of excessive salt and alcohol, increased intake of the fruit and vegetables, and regular exercises. While it is also easily be managed by reducing the smoking and by controlling the body mass index and managing the diabetes. There are various types of anti-hypertensive drugs are available, and if the population is white, that is English man is there, then the ACE inhibitors are the first line of treatment. However, for the black and Asian countries, African and Asian country, previously calcium channel blocker and the thyroid diuretics was considered as an appropriate initial choice. However, it is also now switching to the ACE inhibitors. Problem associated with the hypertension is that there are no symptoms. As there is no symptoms, then patient adherence and patient compliance is very less for that. And usually जब हाइपरटेंशन बिल्कुल अनकंट्रोल हो जाता है और ऑर्गन डैमेज अचीव हो जाता है, जब जाके पेशेंट को ख्याल आता है कि वो ट्रीटमेंट ले. अदरवाइज देयर आर नो मेजर सिम्टम्स और ड्यू टू विच द पेशेंट इज रिलक्टेंट टू टेकिंग मेडिकेशन प्रॉपरली. तो सबसे बड़ा प्रॉब्लम जो है वो फार्मेसी प्रैक्टिस में ये है कि वी हैव टू काउंसिल द पेशेंट that the hypertension is the disease which has no cure. It has to be managed continuously, it has to be checked, it has to be monitored continuously. The main blood pressure is the borderline blood pressure is about 140 to 90 millimeter of Hg, which is considered as now normal value. Previously 120 by 80 was considered as a normal. Now 140 by 90 is considered as a normal blood pressure as an upper limit. There are various risks associated with the elevated blood pressure. If it is continued chronic, one, it will lead to the myocardial infarction. It may also lead to the increased risk of 35 to 40% increased risk of stroke. मैं highlight कर रही हूँ तो थोड़ा सा अटक रहा है मेरा cursor. Then there will be the increased risk of the coronary event, which are and then there will be the 25% increased risk of the renal failure. यानी अगर मैनेज नहीं है तो सिवाय बगैर किसी मेडिकेशन के, बगैर किसी नेफ्रोटॉक्सिक ड्रग के, देयर इज रिस्क ऑफ द रीनल फेलियर.